As you probably know, I worked very closely with your predecessor to improve our state's licensing system. My district has several health care networks that rely on your department to get their medical professionals licensed. And I received many, many complaints. In a House district, I assisted over 110 medical professionals last year in expediting their licenses for a host of different reasons, which Deputy Secretary Harlow was very kind, came down, held a seminar with people from all the medical practices in the area to help people work through the process more efficiently and more effectively. My concern is that we keep the data, we do all the analytics on it. What we're seeing is that this year we're on pace with last year. Now, House Professional Licensure held a hearing. We were told it's a perfect storm, right? So we had staffing challenges, we had IT system replacement at the same time that many medical students were transitioning into residency programs. And we were assured that by Labor Day, this was all going to be fixed. And I know that there were some delays after that. And I really appreciate what you're doing, but I'm very, very concerned that even with all of these improvements, my data is trending to follow last year's data. So I'm hoping that you can follow up with the response to Senator Aument and talk more specifically about what exactly you're doing to streamline it and to educate professionals who are filing that paperwork. Quite honestly, it was becoming one person's full-time job in my district office. So if you could elaborate further, I would really appreciate it.
Absolutely, and thank you, and apologies for how much time it took. As you can imagine, this has been incredibly frustrating for everybody, and it is a huge priority of mine to get to the bottom as quickly as we possibly can. And there's all different pieces of it, right? So if you talk to our IT team who has been involved in this, I've probably met more with them than almost any other piece of the operation, because it's such a huge component, obviously, of the PALS system. And it's not just past, it's present, it's future. And one of the first meetings I had when I became acting secretary was to sit down with them and say, tell me, let's start from the beginning. Is the foundation of PALS strong? Because if it's not, I don't want to invest another dollar in it, right? Let's make sure. So they assured me that absolutely it is. Mistakes were made. We need to make sure that we're constantly shoring it up. But one of the things that I didn't want to do was have us continue on frankly, the expected pace of adding other professions and aspects of the operation to PALS. I didn't want to add more before making sure that we are stable where we are. So we've had, at least weekly, if not more, meetings with the IT team just on that piece of the puzzle. Additionally, we've added staff. So even in the last several months, I think since I think you said fall was one of the times that was bad for your getting reports, is that correct?
Well, it was that time when our medical students had graduated from medical school and were transitioning into their residency programs, which
okay.
I believe was a summer time frame.
Okay.
So that was particularly challenging for us.
Yeah, and so what we do, so we have added. So the way we looked at it is, we need to work on the IT, we need to work on the staffing, and we also need to work on the customer service, right? Because it's one thing to be having problems with licensing processing. It's another thing to not even be able to feel like you're getting the answers to the questions, right? So we added staff on all the above, and frankly, the call time, we've been tracking the call time responses too, because obviously that can tell you a lot about what you're doing wrong or what you're doing right. Currently, 94% of calls are being resolved on the first call. So that's a huge improvement from where we were. The wait time for even being in a call queue are greatly, greatly reduced. And then the staff have also, as I said earlier, if you just look at the last couple of months, Our license processing times are, again, it's currently 9 days across all the different professions. So compare that to a month or two or more is what it had been under the paper system. So having said all that, there's still more we can do, and we are doing. But even in the last couple of months, it's incredibly, I'm optimistic about the direction it's taking, but there's always, the other piece, by the way, is communications, right? Communications, I sort of think of being, 99% of the success or failure of anything you do. And the fact is we need to be better communicating both in the system itself, and then also, as you talked about, to the schools and to the individuals who are a part of the system. So we're bringing on Center for Civic Design, who are experts in helping increase usability of a system. You're familiar with them? They're great. And so they're going to be looking at the system to make sure a large number of our delays are actually due to somebody not submitting everything, right? So we want to make sure that we're as clear as we can be about what they need to do so that they get it in the first time. And we're also increasing our stakeholder engagement, making sure we reach out to the schools and to the professional and licensing entities around the state to make sure they understand how the system works.
Well, reducing user error would be very helpful. So I appreciate that because, I hear from constituents often, it takes me forever to get in to see a physician. And then I hear from healthcare systems that we have physicians who are sitting not seeing patients because they don't have their licenses. So I will look forward to working with you to rectify that. So thank you very much.
And thank you. And please, of course, please keep us posted because it's incredibly helpful when I apologize for all the constituent calls you get, but you have to, but know that each one of those calls that you then talk to us about helps us take the next step forward. So sorry, but thank you.
Thank you.
Yeah.